Welcome to my show. I'm a guest here. His name is Dr. John Jowers. Dr. John, how are you doing, sir?
I'm great. Thanks so much for having me, Temmie.
All right, thank you so much for the time and the opportunity, Dr. John. Firstly, you are a board certified sports medicine specialist. Can you please, Dr. John, discuss more about yourself and how you are doing currently now, Dr. John?
Yes, sir. I'm a physiotherapist in the Washington, D.C. area. As you said, board certified in sports medicine. I'm also a certified strength and conditioning coach, and I hold a variety of other certifications and specialties, including the ability to do dry needling and chiropractic manipulations, various manual therapies, various therapeutic exercise techniques. I've been a physiotherapist for 18 years now.
Beautiful. There is nothing more beautiful than having the sense of coaching others when it comes to sport activities, most especially their injury and other aspects that they can use to improve their health to perform more better in the life they find themselves. Also, from the experience you've had, Dr. John, I would like to know if you've written a book or are you planning to write any book in the coming future, Dr. John?
I do plan on writing one. I'm in the process of writing one right now. No publishing currently lined up, but I've been writing a lot because of my clinical experience and people asking very similar questions, um, and commenting about how my content should be put into a book, but nothing currently. I have various other small publications here and there of my own, meaning just little pages, one page or two here at a time.
Definitely. I definitely hope greater things when it comes to healing absence in the coming future. And that is why I would like to drive to the point of injury. When one faces an injury, it is definitely not easy. It weighs the person down, and most especially, it makes the person weak and unbearable as well to actually perform well because it's actually affect the physical and also the spiritual aspects when an injury comes into place. So many listeners or many people could feel powerless when they face an injury or diagnosis. How do you think education can help them take back control of their healing journey, Dr. John?
Educating themselves removes a lot of the uncertainty behind what's going on with their injury, which ultimately allows us to open up and understand what's going on with the injury. And then eventually that leads to a level of acceptance with the injury. Uh, a good example is our ability to differentiate between types of pain, and knowing that not all things that hurt are necessarily harmful. That's a phrase that I use a lot of. Not all hurt is harm. And a good example is how we might get delayed onset muscle soreness after a workout, and having someone educate themselves on knowing that that is not necessarily a bad thing. If anything, that's a good thing. It's a sign that the muscles are regenerating. Knowing that that is safe and acceptable versus another type of sharp sensation that isn't normal, a muscular strain type of sensation. So that hopefully will incentivize some of us to want to educate ourselves more on the anatomy of our body and the physiology behind pain and how the body interprets pain.
Education is one of the most important aspects when facing an injury. If we understand what we are facing better, then we'll know how to navigate and know how to deal with it as well. And for those that also feel intimidated by medical language, what do you think are some strategies to ask better questions and also truly understand their treatment plans, Dr. John?
Healthcare providers should be presenting a treatment plan to their patients in a way that's easy for patients to understand. It's really frustrating to me when they tend to use medical lingo in a way that just makes it seem like, wow, look how smart I am. I know all this medical lingo. They should be presenting it to their patients in a way that they can understand. And this is what informed consent is. Informing patients, informed consent is a principle that's been around forever, since the beginning of time, but of course has become a more popular topic in most developed nations where uh, patients should be utilizing this in order to, because it's a principle created with them in mind. I don't want anyone listening to feel intimidated by their provider, whether they tend to talk fast or tend to be overwhelming or anything. It's your treatment session. It's your session with that provider. You take the time to stop and ask them to explain a word or explain a diagnosis or a treatment. And if you just genuinely don't understand, take more time to ask more questions about it. If they seem rushed, it's your treatment session. You stay there and ask until you feel like you have a good idea of what's going on. That is what informed consent is.
And that shows that clarification matters. When we are with someone who wants to help us, we need to be in a position whereby we need to be clear with what the person is saying and what we need to ask, because we have to be 100% sure of what we want to take, the action we want to take. And also, the person who is in the position needs to understand better what we are actually explaining to them. So it is a back and forth something with the sense of clarification. It's a very, very important thing we need to understand. Thank you so much, Dr. John, for that beautiful insight. Very important. And also, pain is huge. And also, pain can be in a position whereby it feels very slow. It gets to a position whereby we know that this thing is not fast as I expect it to be. What do you think are some of the tools from the experience you've had as a doctor can help patients to stay motivated and engaged in their rehabilitation process, Dr. John?
It comes down to education and know-how. Once a patient knows what the process is and what the expectations are, then it won't be as surprising to them that progress is as slow as it may be. And in the majority, you're right. In the majority of cases, experiencing pain um, and going through recovery, it does take a slow, long process. And I think it's somewhat worsened in our era of human history that we're in right now because we have immediate access to worldwide information right in our own pockets. And I think it's kind of conditioned us to think that our health outcomes should be the same way when in actuality it takes a long time to have a muscle strain, for example. Just because we can get immediate access to the information about that strain doesn't mean that the strain heals any quicker. We're also used to seeing this very condensed version of someone's care program and in a video form of some sort. They bottled down a 5 month recovery of some injury into a 30-second video clip that we can see quickly on our screens right in front of us, when really that 30 seconds was a lot of work over the course of those 5 months. So that's why education and know-how is so important. Gaining a better expectation, and that might mean having to ask your provider, your healthcare provider, to explain what the expectations will be on both extremes, whether it be a really quick healing time or what's the worst case expectation about how long it could possibly take. A good example in a visible form that many of us are aware of, think of how long it takes Think of how long it takes for a scab to form and heal and then come off. And then for that skin underneath to fully regenerate and go back to its normal state until nothing is visible anymore and there is no more scar. That takes months. And in the same way, it's the same with any other major, like if someone with a concussion or a UTI or a muscle strain or anything along those lines.
It goes back to education. Education is one of the main source for us to know what we need to do and how we can also try our best to explain better and also stay motivated when things are really tough, because pain is very huge. And if we are more educated to an extent, we can help ourselves to do a lot of tremendous, beautiful things that will help us along the way. Thank you so much for the insight, Dr. John. And also, I would like to drive to people who find it difficult to explain, who find it difficult to actually seek help, who find it difficult to actually speak out of probably most especially fear of judgment or cost. Many people are in a position whereby they delay seeking help for fear of judgment or cost. What would you say to the people or the listeners about the importance of early intervention and taking the first step, Dr. John?
I love the question. Thank you. First, a healthcare provider generally will not, or at least should not, judge you for waiting too long to come in for anything. If they do, then that's totally unprofessional, and maybe that's not the right person to go to. But it's understandable. We're human. We might even just be judging ourselves, like, oh, I know I waited too long to get this taken care of. But second, you're right. Early intervention is definitely the best way to go for most medical treatments. It still can be treated if you've been waiting for too long. But that early intervention, look, it doesn't just mean you got an injury. I'm going to keep referring to my common instance of a muscle strain. That doesn't just mean getting treatment within the couple of days that it's happened. It means going a step before it happened and doing preventative care. And our current healthcare system in most developed nations is not set up well for preventative healthcare. It tends to be reactive healthcare. That means treating the strain after it's happened. But after it's happened, the damage has already been done. And now it's just going to be a matter of time, no matter how much treatment intervention you're being prescribed. It's still just got to go through its time period of healing. So the best early intervention is the pre-intervention, the preventative care. And a lot of healthcare providers, though we are in a reactive healthcare system, they are well educated and established in what that looks like. In most countries, the best healthcare providers for doing this are physiotherapists because physiotherapists are the best trained in preventative medicine of all healthcare providers. For physicians, the best tend to be making a generalization, but most physicians who are physiatrists, which is an MD whose board certification is in physical medicine and rehabilitation, they tend to be more on the preventative care side. So you can go along with that education part that we're talking about here, educating yourself more on preventative care for whatever injury it may be. That generally means a combination of good sleep, good nutrition, good healthy lifestyles, and socializing with lots of people. That's good preventative healthcare.
And that is how we can try our best to live a more healthier, a more stronger well-being in the life we find ourselves, Dr. John. Because no one on earth, when we meet someone that we want to seek help from, like a physiotherapist or stuff like that, they will not be in a position to judge. It is more professional. We should know the right time to seek help and also open up. And also, that is why it always go back to education, Dr. John. Because if we are more educated, we will know how to bring out the situation. We will know how to learn the situation, and we will know the right time and also know the right time to take some action and some step as well. So those are the things that we have to try our best to acknowledge and also learn and also develop ourselves in some areas in our life. And also, Dr. John, I would like to drive to the point of family supporting a loved one. Families must always be on our side. We do know that we are in a time whereby families is really scarce, but family are the ones that can be there for us when things are really hard most of the time. And for families supporting a loved one through recovery, how do you think they can be empowered with knowledge to encourage healing without overstepping? That means without crossing some boundaries, Dr. John.
The biggest way that a family member can help in that sense is simply listening.
Mm.
Most of the time, a patient is not going to feel upset that they can't be the one providing physical assistance all the time or something like that. Because most people end up feeling bad, like, oh, I don't want to impose. You've been helping me so much already. Really, most people, no matter what your personality is, you could be strong-willed and hard-headed, or or the exact quite shy. And at all personality types, people are just going to want someone who will listen to them, because it's how the patient is going to be going through a healing process of acceptance, after they've gone past that stage of denial. Accepting it just involves hearing them out, and that simple communication back and forth does so much to build trust between them as a caregiver and a patient.
Thank you so much. Listening is very important. As a person, I do know if we are with a loved one, we want to show the sense of empathy, care, but we have to be in a position whereby we are giving a listening ears. We are listening to their concern. We are listening to their pain. That is the only way they can also be a source of healing. Those listening to also develop them to also heal, because we have to develop that sense of listening when we are with someone who is in a very deep pain or in a serious injury. Thank you so much for that insight, Dr. John. And also, I would like to drive to the point of patients. It is not all about healing when it comes about patient education, because you really drive more to the point of education, isn't all about healing. And how can you think understanding that process can also help listeners feel more emotionally resilient during recovery, Dr. John?
That's a great question. As a physiotherapist, I acknowledge the title physical is in my profession, but healing from something is so multifaceted. You're right. The emotional component is so big, because healing from a physical injury does require emotional resilience. And I think one of the best ways that someone can understand the process and become more emotionally resilient is a combination of, well, of course, educating themselves, as we've been talking about this whole time, but also communicating with others, socialization, and meditation. I'm going to take a little moment right here just to give a plug to the importance of meditation. And it could look like a variety of things. Uh, However you want to call it, it looks like quiet time to yourself with very little to no distractions, where you can be just one with nature and one with yourself, and not think of anything in particular. Take deep breaths, very slow breaths, to calm your mind and bring your mind to a place where there's no judgment. There's only acknowledging of your thoughts, and then bringing your thoughts to uh, almost a place of nothingness where you're literally thinking of nothing. There's so much more that I could talk about that has to do with meditation, and there are plenty of audio clips out there that you could do guided meditation on. No matter what you do, I would encourage patients to start to open up to a meditation practice to improve emotional resilience.
Exactly. Meditation is something that we do know that they are from the ancient time. But when we develop the sense
Yep.
of meditation and also helping our breath and also sitting down and reflecting on ourselves, it is a very, very valuable source for us to heal. And as you said, it is not only through the education. When we are educated to and we're trying to learn from a lot of things, we also have to know how to emotionally meditate and also heal ourselves spiritually, and how we can also develop ourselves as well. I would like to drive to the last question now, Dr. John. So finally, if you think you could give the listeners one piece of education that could empower them for a lifestyle of a better movement and health, what do you think it would be from the experience you've had, Dr. John?
The majority of people that I work with tend to neglect the practice of physical exercise and proper nutrition. We live in a world of convenience and automation, and it's great having those things, cars that get us places so much faster, and uh, a phone that can transfer money immediately. We don't have to go to the bank, etc. These automations are very great, but at the expense of the need to now walk anywhere to get information or to get food or to transfer services or things like that. And at the expense of now we have all these foods that are so processed and so well stored up in packaged bags that they can last for weeks and months on a shelf. Those are generally the kinds of foods that aren't as healthy for us. We need to get back to the basics. That's all I'm saying. And so, if I could just give our listeners one piece of advice, that's to go back to the basics and to look at things the way that they were before automation and before these conveniences, meaning pick up heavy things and pick them up often, as if we lived in a in pre-industrial society, where when we as humans were mostly farmers or hunters and gatherers, we'd have to work hard to get our food. It doesn't have to look like that. Nowadays, it just means picking up weights and lifting weights often and carrying heavy things around. That's going to be so empowering to lifelong health. And yes, it does come with its own set of injuries. And so consult a local physiotherapist or fitness coach if needed to talk to them about how to do it appropriately. But just get started somewhere and start off low and gradually build up. The getting back to the basics with nutrition means eating things that don't have a long shelf life, ideally eating things that don't even have a nutrition label, because if it has a nutrition label, it means it's been pre-processed, it's had so many additives. That means eating things like fruits, vegetables, animal proteins, beans, nuts, seeds, so many things that you can just get right in the produce section of your local grocery store.
Going back to the basic is one of the most important thing that we all need to try our best to understand. And we also need to understand that this basic and these things that we've left away, it's really affecting us in one way. And I really love what you said. We are in a position whereby things are great. The technology makes everything bright, but it makes us feel more lonely. Everything now looks more easier to do, and it makes us a little bit
Right.
isolated in those areas. And going back to the basic, the local food we eat, everything we do, the local exercises, as meditation is something that is in the basic, those things are going to help us to become more stronger and really help us in this time that things are really, really more easier and life in a way whereby a lot of things are more isolated as well. So going back to the basic and also getting to understand and getting more educated to things that can help us improve our healing process is very important and very reliable. To be honest with you, very, very important in our time currently. Also,
Yeah.
Dr. John, there is also a question I normally ask during the end of the show. From our forefathers, from our ancestors, there are a lot of beautiful things that do exist during our ancestral time that is missing in our time today. If there is anyone or anything you would like to bring back to our time today, Dr. John, what do you think that thing will be, Dr. John?
Oh, man, that's a great question. To bring back from our ancestral time, um, the lifestyle. It looked more like communities helping each other, family members needing each other, not just wanting to be around each other or feeling like, oh, we got to meet up for this holiday. It's almost implied because this holiday is coming up, and so we need to see these family members. We're not looking forward to. We need to get back to that period of time from our ancestors when we relied upon each other to to live, not just to survive, but to thrive. Being in small knit communities is is the best way of doing that, because I acknowledge in our current society that's not, we have cars, we're going to be getting out very far away from each other, uh, driving far, living in larger communities, but building a tight knit community within the one that you currently have.
Exactly, because no matter where we are located on earth, there will definitely be people we see around us that we can make friend with, and we can also build reliable community, and also reliable friendship that will help every single one in the community. And also building the sense of kindness and honesty, most especially humility in our time today, is something we do need. And we do hope that those things are something we try to install within ourselves. And also family as well, and also love and care within ourselves is something that we need to bring back, and also try our best to educate ourselves, because education, it goes back to education. When we educate ourselves that no matter how we do on hurt, kindness is still one of the key, because we do not know what every single person are really battling on hurt. So I also want to use this opportunity, Dr. John, to thank you for the time and the opportunity you've given today to every single detail that deals with injury, how one can get themselves educated when it comes to the injury, and also other things, support system and other things we can actually understand better to live a more fulfilled life. Thank you so much, Dr. John.
Yeah, thank you, Temi, for having me. For anyone who's listening, I want to continue the conversation and I want you to feel free to add me on our social media platforms. Most platforms that I'm on, my handle is at Jowers DPT. That's Jowers DPT. That stands for Doctorate of Physical Therapy. And feel free to add me on any major platform that you're on. And I'd love to continue talking with you about any of these topics that we've talked about. Thanks so
All
much
right.
for having me.
All right, Dr. John. Have a wonderful day. Bye bye.
All right. Thanks so much, Temi. Bye.